As one of 4 healthcare professionals in the legislature, I rise in support of SB 323, and I have extensive experience with nurse practitioners in the 6 pharmacies that I've owned and operated in the past 34 years. And I can tell you they're highly professional. There is a requirement today under existing law that they work under the direction, auspices of a physician. I have seen in my practice that this is more of a financial relationship rather than an oversight relationship. But I do want to thank the Senator for bringing this important measure forward. As everyone knows in this chamber, access to health care is critical. In the state of California, and SB 323 will make sure that people have access to health care in our state. The Affordable Health Care Act and Covered California have provided medical coverage to millions of Californians, but what good does it really do if people can't get in to see a primary care physician? And we have a primary care physician shortage in the state of California. The reality is that people need more medical professionals to rely on to give them the treatment they require, especially in rural areas. My county is one of the largest in the state, geographically. I've got a lot of rural areas that don't have primary care physicians that are perfect for nurse practitioners to practice in. SB 323 is attempting to accomplish that by allowing nurse practitioners to provide services to for people who just can't get to see a physician. As a pharmacist, again, I've had the privilege of not only working with nurse practitioners, but as an assistant professor of pharmacology at Cal State Dominguez Hills, I taught graduate nursing students pharmacology. I taught graduate nursing students how to prescribe medicine. And I can tell you that they are very proficient after they take my class. Nurse practitioners are highly educated, having a master's degree, in many cases having a PhD. They are more qualified to handle many of the cases who need the basic medical services, many of the same responsibilities we give to physician assistants that don't have anywhere near the same education as nurse practitioners. Some of the opponents of this legislation have said that expanding the scope of practice for nurse practitioners could harm patients, but I'm telling you that is simply not the case. This bill will not allow a nurse practitioner to just open up a shop in our respective cities or counties and just start providing medical treatment as independent practitioners. This bill will require nurse practitioners to practice in a medical facility. My friends, with more than 1/3 of our population now on Medi-Cal, and very few physicians take Medi-Cal, 1 out of every 2 children are on Medi-Cal, we have a responsibility as a legislature to improve access to health care for this underserved population, and with the hopes that registered nurse practitioners will take the Medi-Cal that physician groups won't take. Until more physicians start taking Medi-Cal patients, we need to find ways for people to receive proper medical care, and this is certainly that modality. I'm sure many of you heard from consultants that they just can't get in to see a doctor. You get sick, you want to get in there tomorrow, I'm sorry, it's going to be 4 weeks before we can get in to see you. God forbid you should have a horrible medical condition where you don't make it to the doctor within 4 weeks because you expire because you didn't get that diagnosis that was desperately needed. If SB 323 is passed and signed into law, our constituents will have the ability to see a qualified medical professional when they need care that was promised by the Affordable Health Care Act. To my colleagues here today, I just want to say that SB 323 is good common sense legislation. It improves access to care. It will keep people seeking regular medical attention out of our emergency rooms, which is a problem for all of us in all of our districts, as we see people using our emergency rooms for primary care visits and not for emergency room visits, which is very costly. And certainly, it will not jeopardize public safety. Whether or not you agree with the Affordable Health Care Act, we have to remember that it is, in fact, the law of the land. People need medical care, and this legislation will go a long way towards making sure that we can provide care to our constituents. I urge you to vote yes on SB 323. Please join me, nurse practitioners, and AARP's 2.3 million members that we rarely see coming out and supporting or opposing bills, but they are strongly in support of this one. Again, I want to thank the author for his hard work on this measure and urge an aye vote on SB 323.